Hi, this is Ted Hsu, your Member of Parliament for Kingston and the Islands, and thank you for joining me on The Local View with Ted Hsu, the show that brings a fresh perspective to your community and your federal government. Today's show is about the Kingston Community Health Centres, child poverty, high school dropout rates, support for new immigrants, and services for seniors' health and well-being. These are all issues that communities have to grapple with. How do we provide services to support all of these needs, and how do we build a community? Well, Wendy, maybe you could just tell me a little bit about Kingston Community Health Centres, and maybe just start off with the big picture, the mission of Kingston Community Health Centres, and how do you measure your success, and what would you like Kingston to look like, in particular Kingston's North End, where you're located. What would you like to that to look like a generation from now?
Well, our mission is to care, to respond, and to build communities. And our vision for the future, or what North Kingston might look like 20 years from now, is a community where young people thrive, seniors have supports, where there's diversity and an overall sense of well-being in the community. Mm-hmm. And the programs that we've developed at Kingston Community Health Centres all work toward that goal. Over 150 staff.
Wow, so it's big. And how many clients would you have?
Over 9,000.
Wow, so you're serving a pretty significant chunk of the population of Kingston.
We are, right. And it's very exciting, and we have a wonderful team of staff to support them.
Okay. There is sort of short-term employment that comes from the Canada Summer Jobs Program. This is a federal program that hires, I think, about 150 students every summer here in Kingston and the Islands, but across the country, of course, many students. And I understand that there were 4 positions at the Kingston Community Health Centres this summer. I was wondering if you could tell me about the 4 positions, and maybe tell me a bit about the students. If you may or may not have known them because they may have worked in your area or a different area, but maybe if you could tell me a little bit about the students that filled those positions, as well as what they did.
Well, the positions, I think, were great learning opportunities for them. And we had one student who was placed with our street health center and was a harm reduction assistant. So providing outreach in the community and access to resources to help improve people's quality of health, and helping them know what services were available to them. And what's exciting about the student who was in that position is she's still employed with KCHC on a part-time basis, which is something that we love to see. Another student worked with our Better Beginnings program, which is the programming for young children, and she helped with outreach and engagement and interaction and increasing awareness of the services that are available. And then the 2 other students worked with both our community development team, our immigrant services team, and our KIP group, which is a partnership where we have the Kingston Immigration Partnership. And with that, we had 2 major festivals in Kingston, the Scarecrow Festival, as well as the Multicultural Festival in Kingston, which is a fantastic event. And the students contribute so much to us, and what's important to note is that as a community-based organization, we rely heavily on student placements and subsidized student job opportunities, because we can't do all of the work that we want and need to do. So the students are critical to the program's success, and we already rely heavily on volunteers at KCHC. The past year we had over 12,000 volunteer hours contributed. So the student opportunities, I think, are meaningful training opportunities for them, a great opportunity to acquire new skills, and we treat them as though they will be long-term employees with us, and we want them to come back.
Okay. Well, I'm glad to hear that, because the Canada Summer Jobs Program it's not a make-work program for students, and it's not a way of donating time to organizations. It's really a way of giving students experience so that a potential employer can pick up the resume and say, oh, you did that. That makes you a much more desirable employee, and I want to hire you. I think it really is focused on getting students that experience, paid experience in a real job that makes them a really valuable employee for the same employer, or maybe a different employer whoever's next.
They're integral members of our team.
Great. There's a lot of good work that's done by KCHC. what supports that? There's 150 staff. Where does the money come from to support that work?
It's our funding is complex because it does come from so many different sources. So our healthcare services are funded by the Ministry of Health. Our immigrant services are funded by Citizenship and Immigration Canada. Pathways to Education, we have 3 sources of funding there. And the other source of funding that is very important to us is the United Way. So we're a member agency, and that is key to us. Okay,
great. Well, thank you very much, Wendy, for joining me today and telling us all about Kingston Community Health Centres.
Thank you so much.
And I look forward to that vision being realized.
Thanks.
Well, breaking the cycle of poverty, revitalizing neighborhoods, building communities, and nurturing youth so that they can take advantage of the opportunities that this country offers and should offer to all young people. The Kingston Community Health Centres is working on these and is going to help change Kingston. I think we should all be excited to look forward to an optimistic vision of the future as we do our work and to try to build this community. You've been watching The Local View with Ted Hsu, your Member of Parliament for Kingston and the Islands. Thank you very much for joining me, and I'll see you next time on The Local View.